Hello and welcome to Health Matters. I'm Mary Alale Yusuf. Could anything be more common than pain? Pain is a universal feeling. It's so common that sometimes we just ignore it. Now, the feeling of pain is triggered off in the nerves. It could come in different forms, sharp, dull, could start and stop, or go on indefinitely. It could be localized, that's in one place, or generalized all over the body. What should our attitude to pain really be? Can we live pain-free? Is any sort of pain a good sign? Now, these questions and more will be answered. I'll be posing these questions to my guest on today's program. He is Dr. Femi Ogunyemi. He's a pain management consultant, pain management specialist, anesthesiologist, and medical director of the Lagos Pain Clinic, Ikoyi. You're welcome to the program, Dr. Ogunyemi.
Thank you very much. It's a pleasure to be here.
Now, pain may be treatment for pain may be very common in other places, but so many conditions can cause pain.
Yes.
All sorts of conditions can cause pain. What then is the rationale behind having a special segment dedicated to the treatment of pain?
That's a very good question. Pain is very complex, as you have already said. You know, it can be acute, it can be chronic. Most doctors in general can treat acute pain. Acute pain is pain that you have over a 3 to 12-week period. You know, like a broken bone, like a woman having a baby, like the pain that comes after you've had surgery. All those things are acute pain. The wound heals, the pain goes away. And like I said, most doctors can treat that. But chronic pain is the one that has persisted longer than 3 months. The definition actually takes it from 6 months, but most doctors nowadays say any pain that has gone longer than 3 months is chronic persistent pain. Causes of such pain can be from your joints, from the bone, for instance, arthritis. It can be from the muscles, conditions we call fibromyalgia, myofascial pain syndrome. It can be from the nerves, what we call neuropathic pain.
Why would the nerves cause pain themselves? Aren't they the pain receptors?
They are the pain conductors. They take messages from the receptors, they conduct it through the nerves to the spine and to the brain.
That must really be painful, nerve pain.
Actually, the nerves in the central nervous system don't feel any pain at all.
Okay.
In the spinal cord and the brain, often if you put a nail through somebody's head, the skull will hurt, but inside the brain, there will be no pain.
Now, pain, they say, is usually an indication of something else, something deeper that is the matter with the person, not the pain itself.
Yes.
If indeed the pain is pointing to something else, why do we handle the pain? What if that other condition worsens?
Yes. Again, a very good question. Let's first define pain.
Okay.
Pain is defined as an unpleasant sensory and emotional experience that is associated with tissue damage, actual tissue damage, or potential tissue damage, which basically means there may not be any tissue damage at all.
Okay.
Okay. That seems complicated, but in simple terms, pain is whatever hurts. Now, your question is, you know, do we address the pain itself? What about the underlying cause of the
exactly
pain? Often you can treat both, and I have to say sometimes you cannot find an underlying cause.
Okay.
But because you cannot find the underlying cause does not mean you should suffer in pain. We can still treat the pain, but we do try to treat both the pain and the underlying cause.
Okay, so there's no fear that, okay, maybe something is getting rotten, or, well, to use lay language, in the body, and they're just treating the pain, making the person feel nice.
No.
And, you know, that organ is just wasting away?
Absolutely not. No.
Okay.
Pain is actually nature's warning sign. It's a warning sign. When something starts hurting you, you take notice of it, and you take precautions to reduce the pain. You know, it's easy it's important in our practice not just to treat the pain itself, but to try to find the cause of the pain. Commonly, degenerative changes, wear and tear, just getting older itself will cause changes that will lead to pain. Those kind of things causes degeneration. We can't really do much about. If there's degeneration in the spine, if there's degeneration in the joints, except if we replace the joints.
Okay.
The pain will be persistent. So in those situations, we have to treat the pain, but we cannot do much about the cause of the pain.
Okay.
Yes.
Now, at what point does a patient actually come to see a pain specialist? Would this person have gone through, series of doctors
Yes.
before coming to see you?
Yes.
So by the time the patient gets to you, you most probably already know what's causing the pain?
Well, not typically. We have an idea. By the time the patient gets to a pain specialist, like I said, acute pain in the first 3 months, they think the pain is going to go away. They go to different doctors, and most doctors can handle that. But when the pain becomes persistent, then they come to see a pain specialist. And what we do at that time, take a history, do an examination. There's some things we do certain tests and investigations, and we're able to find out exactly what type of pain it is and what to do about it. That is why pain management is actually, it's only been in the last 30, 35 years. It's actually a very young specialty.
Even, globally?
Globally, yes.
Okay.
Yes.
So everybody's still getting used to this?
Everybody's still getting to use, even in the Western countries, absolutely, yes.
Okay, now those are referred pains. We'll come to what's on the screen a bit later. But obviously, when a patient comes to a pain specialist, one of his symptoms is going to be pain.
Absolutely, yes.
Are there other symptoms that accompany?
Very excellent question. By the time